This is Penny, a 15 one-hand, 17-year-old chestnut quarter horse, and we're going to be doing a neurological exam on her today. To start, we're going to assess her mentation and behavior.
Penny is showing normal behavior and is observant of her surroundings. She's bright, alert, and responsive, and no abnormalities or concerns were reported by her owner.
We will next assess Penny's posture and observe if she has any head tilting or abnormal head turns. We will also assess if she's favoring one leg more than the other, which could be an indication that she is in some level of pain or discomfort.
Based on our observations, Penny has very good posture, she has normal placement of all four limbs, and her head is not tilted and is also level with her withers.
Now we are going to watch Penny move by walking and trotting her in a straight line.
Penny appears to have no issues walking or trotting. She is not exaggerating any limb movements and is not stumbling or dragging her limbs. Her stride length is normal and she is not placing her limbs abnormally while she is moving.
We will now turn Penny in tight circles to the left and to the right at a walk and a trot, as well as ask her to back up a few paces.
Penny can easily turn without losing balance or posture and does not misplace any of her limbs or have any delayed limb placement. She has no exaggerated movements, which indicates intact proprioception and no ataxia. She backs up with ease, which indicates no ataxia or proprioceptive deficits.
Penny has no issues supporting her weight as she moves freely. She doesn't demonstrate ataxia and she has proper limb movement and placement. She does have some signs of lameness on her left front, but that is not related to any neurological issue. Now we're going to test Penny's limb awareness and proprioception more in depth. First, we will weave Penny around some obstacles.
Penny doesn't show any signs of stumbling or misplacing her limbs, indicating that she has intact limb coordination and awareness, therefore her proprioception is intact.
Next, we will use the log test to further test her proprioception.
Penny does not trip over any of the logs and shifts her legs to move over each one, which indicates that she is aware of her limb placement and therefore her proprioception is intact.
Next, we'll ask Penny to side pass and see if she crosses over evenly and shows any signs of loss of balance or abnormal limb placement.
Penny crosses her limbs correctly and doesn't stumble or misplace her limbs or have any delayed limb movement. This means she has good coordination between her limbs as well as good balance.
Now we will pivot Penny on her front end and watch to see if her hind end crosses over properly and if she has any abnormal limb placement or movement.
Penny's hind legs cross properly, and she has no excessive reaching or stumbling and does not lose her balance while turning. This indicates that proprioception and motor control are intact.
In the next part of our exam, we are going to test limb strength. First, we will do the hind limbs. We will walk Penny while pulling her tail to the side to test Penny's ability to resist lateral displacement.
Penny resists the tail pull and does not fall or lose balance. This indicates that she has good balance and strong hind limb muscles.
Now we'll test Penny's forelimb strength. To do this, we'll apply pressure to Penny's shoulder to evaluate her resistance to the pressure.
Penny resists the change in pressure and shows no weakness. This indicates that Penny has good muscle strength as well as strong stability and balance in her forelimbs.
During the next section of our exam, we are going to test Penny's cranial nerves. To start, we're going to assess the symmetry of her neck muscles and the symmetry of her head and muzzle.
Penny has symmetrical neck muscles, which means that cranial nerve 11 is intact. No muscle atrophy was indicated, and both sides of her head look even and symmetrical. There is no muscle atrophy or any muscle drooping observed of her face, meaning that both cranial nerve 5 and 7 are intact.
Next, we will move our hand towards Penny's eye in order to push air towards the cornea. This tests cranial nerve 5, the sensory component of the eye, and cranial nerve 7 for the motor component of the eye.
Penny blinks in response to feeling the air on her cornea, indicating that cranial nerve 5 and 7 are functioning normally.
Now we will check Penny's vision and motor function of her eye by using the Menace response. Doing this test, we need to make sure not to push air into her eye.
Penny blinks at the movement, indicating that she can see the hand. This indicates that cranial nerve 2 is intact, and cranial nerve 7 is also intact as she was able to blink.
We will now check the palpebral reflex. To do this, we will touch the skin around the eye.
Blinking is present and symmetrical, which means that Penny can feel the touch and can elicit a motor response. This means that cranial nerve 5 and 7 are working.
We will next do the pupillary light reflex for cranial nerve 2, the sensory component of the eye, and cranial nerve 3, the motor component that constricts the pupil.
Both pupils constrict appropriately in response to the light, and the pupils appear to be the same size. This indicates that cranial nerve 2 and 3 are intact. Next, we're going to test the sensation and motor function of the face and muzzle using various facial reflexes.
When touching the vibrissae, Penny moved her lips, which indicates she has intact sensory function from the maxillary branch of trigeminal and motor function from the facial nerve. A Q-tip was placed in her ear to test the auricular reflex. In response, she moved her ear and head and blinked, which indicates that cranial nerve 5 and 7 are intact as they both have sensory input to the ear and cranial nerve 7 has motor input to the ear.
When the Q-tip was placed in her nostril, Penny reacted to it and moved her head away, indicating that the sensory aspect of cranial nerve 5 is functioning. Penny also had a normal swallowing reflex, indicating that she has an intact gag reflex. This demonstrates that cranial nerve 9 and 10 are also intact. Now we will check the function and symmetry of the tongue.
The tongue is straight and moves evenly and freely inside the mouth. This indicates that cranial nerve 12 is intact. Next, we'll put a treat in front of Penny's nose to see if she can smell it.
Yeah, should I tell her this is how you're supposed to behave?
Here, Penny sniffs the phone, indicating that cranial nerve 1 is functional.
What is this?
The last cranial nerve test we will do is to observe cranial nerve 8, which is involved in balance.
Penny appears to have no issue with maintaining her balance during this test. She doesn't stumble and is able to correct for the change in balance.
In the last part of our exam, we will check for spinal reflexes and sensation. I will palpate for any abnormalities along the body and limbs and apply pressure with the soft part of a hoof pick to check for sensation.
Penny responds to all areas that were touched, indicating that sensation is present and the dermatomes are intact. When palpating the limbs, spine, and head, there were no abnormalities such as swellings or masses, and there was no pain response. She does have some atrophy in her paraspinal muscles near her withers, but that could be disuse atrophy from not being worked throughout the winter or loss of weight from the extremely cold weather that has occurred in Saskatchewan.
Next, we'll check Penny's tail tone by moving Penny's tail from side to side and seeing if it is flaccid.
Penny's tail is not flaccid and does not have any increased or decreased resistance. If she had flaccidity in her tail, this could indicate neurological damage potentially involving the cauda equina or other related nerves.
Now we will check the perineal reflex and defecation. She has normal defecation, which means her gastrocolic reflex is intact, which is controlled by vagal stimulation of the autonomic nervous system, which influences the enteric nervous system.
Anal tone is normal, indicating that the sensory and motor components of the perineum are intact, as well as spinal segments S1 to S3.
This completes our neurological exam. Based on our findings, everything appears normal, no signs of ataxia, weakness, cranial nerve deficits, or abnormal proprioception and balance.
If any abnormalities were found, further testing would have to be done on Penny to determine the cause and neurological location for the abnormalities.